Um, One of the differences between what I'm going to talk about and the previous presentation is that the previous presenter gave a very comprehensive overview of some of the digital technologies that are available for supporting patients. I'm looking at the situation from a different perspective, and that is to look at it, the impact of people in the medical profession, both nurses and doctors, and how artificial intelligence and some of the disruptive technologies that Giuseppe mentioned in his presentation are going to affect the role of nurses and doctors and the way things operate. And to start the presentation off, I'm showing you a picture of myself or what AI can do for me. It makes me look like a pirate, or it made me look like a pirate, and I look younger, probably more handsome, and more windswept and interesting. So my background is not medical, even though I'm a vice president of the International Society of Digital Medicine and been involved in preventative digital healthcare for many years. My background is in creative technologies, so I use AI quite substantially in my work. So a lot of what you see today is AI generated. And so I'm going to begin by looking at a fairy story from the 1950s as a way of illustrating the way in which nursing has changed over that time. And the fairy story is about a little girl called Ella. I've nicknamed her Cinders for reasons why I'm going to. And she dreamed about becoming a nurse when she grew up. So there she is lying in bed, dreaming about the future of nursing. So she had things like a nurse's outfit and she loved watching all movies and television shows involved in nursing. And one day she became a nurse, a reality, and she loved helping out patients. And that was a dream that started in the 1950s. But nursing is very different today. So I'm going to have a look at what happened to the dreams of the 1950s and the reality of the 21st century. So what I'm looking to do is to explore some of the challenges that everyone faces, not just those in nursing, but the disruptive effects of these technologies on all knowledge professionals. We live in challenging times. We all seen the pressure of, particularly as a result of COVID-19, that's made an amazing difference to what it experiences in hospital environments. And the aging society is one of those results of developments in my lifetime that have helped to improve longevity. But at the same time, although it's increased our lifespan, it's generated some problems which include loneliness and social isolation. And because of some of the pressures that we're feeling in health services, the care for the elderly is shifting from families to the community. And all of these changes that I'm going to mention in my presentation are going to have an impact on what it's like to be a nurse or a doctor. And one of the challenges of the aging society is the comorbidity challenge. The video on the left-hand side is my partner's late father, who spent the last year of his life living with us. We were looking after him. Mainly my partner, Eric's daughter, and this was an example of the daily drug routine that Eric had in the last year of his life until it came to the point where had to be put on palliative care because he was nearing the end of his life. And the number of drugs that you see on the left-hand side of the table were reduced to the ones that you see on the right-hand side. But the comorbidity has challenges also in the fact not only it's expensive to keep people alive, but it also means that a lot of the drugs that Eric was taking don't necessarily work well together. So there are many different challenges in the aging society. We're living longer, but we need more medical care as we age, and there are fewer working people to provide the funding that national health services need. And as a result of this, elderly care tends to be underfunded, and pandemics have only served to exacerbate that problem. So, whereas the previous presenter was talking about how we look after patients and provide interventions to people who are in health, the former chief executive of the National Health Service, Sir Simon Stevens, recognised what's in the pipeline for us. And that is that we are facing a total collapse of public health services because of all of these problems of the ageing society. And his recommendation was that we really need to transition from cure to prevention. And the best way that we're able to not only increase our lifespan, but improve the quality of life as we age, is to adjust our personal behaviors and to do so at an early age. And some of the applications that Giuseppe showed are designed exactly to do that. So one of the things that I've been observing in my lifetime is that the doctor's role necessarily is beginning to shift from cure to prevention. Doctors will always have a role for curing problems, but increasingly, because of the challenges that we face with the aging society, it will be increasingly important to be able to coach patients or coach people coming to see them to help them to live a healthier lifestyle. And the same is happening for nurses. Nurses are going to have an increasing role, particularly in community healthcare, for preventative healthcare. It's not only helping people who have chronic medical conditions to be able to manage those conditions and prevent them from worsening, but also to work and encourage people who are healthy, in inverted commas, to manage their personal health better. And this is where I've seen a lot of the advances in digital medicine and digital health coming on. And so, life after COVID-19, coronavirus has really served to accelerate the digital revolution that was already taking place. And what we've seen as a result of COVID-19 is the growth of telemedicine, remote support for patients, but also because of the challenges of restrictions on physical contact, it's meant that a lot of the interventions, a lot of the care have to be done remotely. Now, my long-standing involvement in digital health and digital medicine arises from 11 years ago when I decided to gamify my health. Giuseppe mentioned serious games, and it was in 2013 that I, not because of any ill health problems, but because I had people telling me I was fat. I did a DNA test that revealed I got a higher risk of diabetes too. And this led me, by coincidence, to look at wearable technologies and fitness trackers. And so I decided to see if I could improve my own personal health through one of the early fitness trackers. It was called the Jawbone Up, and it measured my steps, it measured my sleep, and it also helped me to record what I ate and helped me to manage the calorific intake and expenditure of my life. And it transformed my life. Within 3 months of starting this, I started by doing exercise, walking 10,000 steps every day. And within 3 months, I lost 21 kilos. So that proved to me that some of these technologies can influence lifestyle behaviors. And as a result, can help you to manage your own personal health. So I'm now 75 years old. I still walk 5 miles every day. I don't take any medication at all, and I live a full and active life, which involves presenting at conferences like this, not just online, but around the world. So another impact of COVID-19 has been that we are shifting from family home care to care home care. And that's partly a result of the so-called atomic societies, where there's greater mobility amongst families. families don't stay in the same area all the time. Children leave home, live in a different place. Very often, they're not able to look after their parents in the home environment. I know a lot of people are cared for by their family at home, but there's a trend towards moving towards care homes. And this is true in my own case with my mother. When she became unable to look after herself, she first of all went into assisted living accommodation and eventually finished up in a care home where there was 24 by 7 care available because it wasn't possible for me to look after her. And one of the people that's inspired me recently is a lady, I think her name is Joyce Simister. She set up an organization called Namaste. And I'm showing her as an example of how nurses have such an important role to play to protect humanity and to make sure that the human values and the roles of nursing are not going to be replaced by artificial intelligence. Now, these are some of the technologies that I've seen evolve so rapidly in my lifetime and that are disrupting all of our lives. Artificial intelligence and machine learning, it's accelerating at a rate that I don't think anyone could have predicted. And the wearables and biometric devices that Giuseppe showed many examples in his presentation, they're increasingly becoming medical grade. So they're going beyond consumer devices to being devices which have FDA approval and clinical approval, whether that is through hardware capabilities or software capabilities. And in the UK, we have an accreditation program called DTAC, run by an organisation called Orca, who evaluate particularly mobile applications to make sure that they are not harmful to their users. So it's pretty much like the FDA. 5G, 6G now, and broadband technologies make it possible, for example, to do presentations like the one that I'm doing today. And smartphones and mobile applications, as Giuseppe said, there are tens of thousands of these for a multiplicity of different applications. And he also mentioned virtual reality and simulation technologies, which are playing an important part in digital therapeutics. And it's the connection of all of these technologies through the Internet of Things, which has substantial potential for protecting and preserving the sustainability of future healthcare. So here's some other more examples of preventative healthcare and digital therapeutics. There's a proof of concept device, which is a patch that you put on your arm, which interacts and measures your vital signs. There are many different technologies that do this. I'm using three at this very moment. I have a smart ring, I have a smart watch, and I also have a glucose sensor. And I use this combination of technologies to help me manage my diet and nutrition and exercise. But there are also digital therapeutics technologies that have an alternative for drugs. And there's some examples of these with a 360-degree projector. So you'll sit in a room and you're placed in an immersive environment. This allows people to experience things that maybe they're not able to experience because of their circumstances, whether they're disabled, whether they're elderly. They can share these experiences, and these are particularly important for conditions like dementia and some mental health problems. Giuseppe also mentioned rehabilitation technology, and I work with a company in Italy called Imaginary who have a product called Rehability, and it uses technology that allows people suffering from Parkinson's disease, rehabilitation from a stroke, a whole range of conditions to be able to take these therapeutics at home on the standard television set with something that's equivalent to a webcam. And this allows people to do physician controlled, physician managed exercise in their home environment. So technology has had a really significant impact, and in particular, artificial intelligence is already affecting nursing roles and responsibilities and practices because it empowers nurses to be able to take on different kinds of tasks supported by verifiable and validated artificial intelligence. And what it also means is that nurses and lower grade physicians are able to take on roles that were traditionally done by doctors and people with substantial nursing training. And this is disrupting long established practices. And here's some examples of artificial intelligence virtual reality and how that's affecting who does what. And on the right-hand side, you'll see an example of a robotic surgical device, which adds to the accuracy of the surgical practices. And it means that surgeons are able to bear less responsibility for their physical capabilities. And as an example of that, the video in the middle is actually my partner who has no clinical training. She's actually a little bit of a Luddite. She doesn't really like technology at all, but she came with me to Kuala Lumpur, and I presented at a conference, and they had an exhibition with demonstrations, and this was a training device for laparoscopic surgery. So what it means is that you get so-called haptic feedback, and this is used to train surgeons. And the idea is that you're removing a gallstone, and you can see the process on the screen in front of you, and you have to use your skills, your dexterity to be able to remove the gallstone as quickly as possible with a minimal damage. And it turns out that my partner was getting better results than some trainee surgeons. So that's quite a sobering thought as to whether, when you're being operated on, is it better to be operated on by, say, a teenager who's very good at video games and very skilled with these types of controls, or an experienced surgeon who may be suffering from some physical defects as he's grown older. Nursing education has also been impacted by different practices such as holographic interactive learning devices, and AI supporting human intuition. This combination of AI and human beings can help to identify risks earlier. And it's also, there's some evidence to show that artificial intelligence is actually better at early detection of cancer and tumors than human beings. But if you combine an experienced radiologist and artificial intelligence, you're likely to get better outcomes. So I see this as really the way to proceed, is to think of it, AI and some of the disruptive technologies, as a way of enhancing decision making, and as a process in which humans and technology collaborate. Remote patient care was mentioned by Giuseppe, and it's important that whatever care that is done remotely, it is not a replacement for human factors. So technology in the way that it works, but must also bear in mind and incorporate empathy, which is a very important part of treating patients. And of course, as with many commercial or other outside activities in society and business, AI can have a big impact on resource planning and optimization that helps to make sure that human resources are used as effectively and productively as possible. But going back to the point that I mentioned earlier, artificial intelligence must not overrule humanity. It can help, but it must not be the ultimate arbiter of life and death. So the good news for the nursing profession is that I believe that artificial intelligence and technologies like virtual reality are likely to benefit the nursing profession substantially. So, in summary, and to conclude, we're living in a world where it's absolutely essential to shift from cure to prevention. Otherwise, our health services will collapse. And COVID-19, and there will be other pandemics, they've accelerated the use of digital technologies. And these technologies are both empowering, but they're also disruptive and challenging to some existing knowledge professionals. Nurses' roles are likely to change and upgrade. And digital therapeutics, and as Giuseppe mentioned, are going to be able to support rehabilitation, stress management, and preventative healthcare. But humanity and empathy in all of this must be paramount. And at the end of the day, nurses will become increasingly valuable. So it's good news, I believe, for the nursing profession. And I think we all owe a great debt of gratitude to those in the nursing profession who've seen the challenges that we've faced, particularly since no COVID-19. So I'm ready now to stop sharing and invite any questions.
Thank you so much, David, for your wonderful presentation. That was really interesting for all the audience. Just a few questions like, are all the hospitals equipped with these facilities to train their nurses?
Sorry, could you repeat that?
Are all the hospitals equipped with these challenges that AI
Mm,
is
no,
posing?
no,
Mhm.
no. They no. I think they're actually in the minority. This is one of the problem, and this is one of the issues with artificial intelligence is that it's understandable that people are naturally suspicious of artificial intelligence. Because it can have some very negative effects outside the medical profession, where hopefully, AI applications are clinically validated. There's still a reluctance, and that reluctance is primarily within the medical profession. Um, but it's the way in which digital technologies are consumerizing technology means that the kind of applications that I've shown you are increasingly affordable. So, although they are not prevalent within hospitals today, I think increasingly they will become part of everyday hospital practices.
Great, good to know that. And do you have any devices on this which are there in the market currently and is available?
Well, I use, and this is not a recommendation, but I can only tell you my own personal experience. There are two devices that I use, which and the mobile applications, which are, I think, having a particularly significant effect on the way in which manage my health. The first of these is a smart ring, which cost me round about 90 euros. And the thing about this smart ring is that not only does it measure many of the vital signs that doctors already use, it's continuous monitoring in real time. So it collects a history. So if I need medical treatment, I'm not just going in to have a one-off test or a test at a particular point in time. The medical profession have access to the history of how my vital signs have changed, whether my sleep, my resting heart rate, my oxygen saturation levels. All of this data is immediately available, so it will help to improve the diagnosis. And now the smart ring that I use has what's called AI insights. So every week I get a health index report that gives me a breakdown of how my sleep and my physical activity and all of the things involved in lifestyle medicine have changed to give me recommendations of what I need to look at. So that's a smart ring. But the blood glucose monitor, I use a device called Lingo, which is basically the Freestyle Libre blood glucose monitor. And I think this is one of the most significant devices because it gives me almost instant information about the impact of food and diet on my body. So within a short space of time after I've had a meal, if I'm having something with a high sugar level, something that's good for me, I see spikes in my glucose. And that allows me to moderate my diet, which is one of the most significant components of lifestyle medicine. So those two types of devices I think are going to be particularly important.
Great to know about that devices. Thank you so much, David, for your wonderful insights on the AI aspect into the nursing healthcare sector. Yeah.
Well,
Uh,
thank you for the opportunity to talk to you today. I'm afraid I'm going to have to leave you now because I'm going to Amsterdam tomorrow to speak at the Games for Health Europe conference, where I'll be looking more at the use of gamification in this context.
great to know about your upcoming projects as well. Yeah, sure.
Okay,
You'll have a
thank you.
good time in Amsterdam as well. Thank you so much, and yeah,
Thank you. Bye bye. Bye
thank
bye
you.
to everyone.
Bye bye.